Welcome back to Great Day Houston. We're still celebrating our Astros, but on to football now. When Texans quarterback Deshaun Watson had that torn ACL, we all hurt for him. He's out for the season. Fact of the matter is, it can happen to almost anybody, not just pro athletes. Joining us with details on how to address those types of injuries is Dr. Raj Shani, orthopedic surgeon with Memorial Herman Greater Heights. Hello
Thank you for
there.
having me.
All right, this was a non-contact injury for Watson, but for a lot of us, we think that we have to be in some type of crisis mode and doing something really crazy to get this type of injury. Not so.
No, it can actually happen to anybody, stepping off a curb, as you may know.
Yeah, I stepped off a curb and I stepped off the wrong way,
Right.
and my knee just started hurting, and I thought, okay, something's more wrong with this than just twisting it.
Right, right. And it's usually a non-contact type of twisting, pivoting type of motion on the knee that can cause this. Oftentimes people feel a pop or immediate swelling, and they're not able to put weight on it. And then you feel buckling or your knee's giving away. And those are kind of telltale signs that you may have torn your ACL.
Yeah, all right, we're looking at that diagram right now. There's a lot more going on inside of there than obviously we can see from the outside. Right. So right here you have a model that can kind of tell us what's going on. So we have several pieces inside that.
Sure. So we're going to look at the knee model here. We've got the kneecap or patella in front right here. We're going to move that to the side here, and then we're going to see some of the major ligaments of the knee right here. We see the thigh bone or the femur and the tibia bone or the shin bone. And the ACL is this ligament here that goes from the shin bone all the way up to the femur right here. And that's where the tear can occur. Yeah,
so really small but can cause big problems.
Big problems and a lot of instability in that knee.
Okay, so we mentioned earlier like the pop, the swelling, the whole bit.
Right.
Again, a lot of people may mistake that for just being I twisted it wrong and needs time to heal.
Right.
At what point should we cut bait and come in?
If it hasn't gotten better within 48 to 72 hours, the swelling still persists, come on in and get checked out by your orthopedist and let him or her make the decision.
Yeah, all right. Heat or ice?
Initially, for the swelling, I recommend ice. Okay. Ice, compression, elevation, staying off of it. After a few days, if the swelling goes down, then you can transition to a heat. But first, ice. There's
a lot of things we can do today that we couldn't do years ago, and so a lot of people may be putting it off because they remember what that surgery could have looked like back in the olden days, I should say. As my son says, back in the olden days, Mom, didn't you remember the olden days? But there's different ways that we can treat this now.
Right. So it's a very common injury, the ACL. There's actually over 200,000 ACL surgeries done last year. And just within this year, there's about 48 to 49 ACLs that happen in the NFL just this year alone. So it's a very common injury. Now, the way we treat those is for most athletic people who want to stay athletic, who want to do sports, we recommend surgery for that. Yeah.
And what does surgery entail?
Surgery entails, well, let me take a step back. Surgery entails of, you can't just repair the ACL. Right. It needs to be reconstructed.
And normally it's not going to repair itself, is it?
No, it will not repair itself. So you need to reconstruct or put a new ACL in there. You got two options. You can either take it part of your own or you can take it part of a donor. And what we're seeing in the model here is where we take a strip of the patellar tendon and we reconstruct the ACL by drilling holes into the bone and allowing them, putting a new graft into the ACL.
And I gotta say, although you're looking at it right there, you're not feeling any of this.
No, you're asleep, you're in exercise, and you won't feel anything. You'll go to sleep and you'll wake up with a brand new ACL.
Yeah, and I gotta tell you, like there's like little stitch marks on my knee, but it's not big scarring there at all. All right, as you mentioned, that's for the person who probably a little bit younger, who's gonna be much more active, like you said, like an athlete. What other options are there for folks?
So, if you're planning to be active or do any aggressive sports besides just running, then I would recommend getting your ACL done. If that's not something you want to do and it's more of a less active lifestyle, then physical therapy with bracings is also an option. Okay,
and then the surgery with a screw or a staple?
Yes.
Okay.
Yeah. So these are just ways how we attach the ACL to the bone. Yeah. And so when we have the new graft that we put in, we can attach it with screws, buttons, staples, all different kind of things. But the main thing is which type of graft we're going to use and how we're going to reconstruct, and the physical therapy that goes after it.
Yeah, and that physical therapy can take a while. So this is something that doesn't heal overnight. Right. What's recovery generally like?
So for the first maybe week or two, you may be using crutches as the pain goes down. With time, you'll be doing physical therapy. You'll go to physical therapy maybe 2 or 3 times a week. And you'll start maybe running by 3 months. The plan to get back to sports is anywhere from 6 to 8 months, even longer if you're a high-level athlete, maybe could up to a year.
Yeah, my plan was just to get back into high heels, and it happened.
Good.
All right. Dr. Shani, thank you very much.
Thank you very much for having me.
All right. Memorial Herman Greater Heights Hospital. For more information, you can schedule an appointment at 713-486-4900, 713-486-4900, or log on to memorialherman.org/orthopedics.